Hello, everyone. Welcome to today's Code for Crohn's webinar, an interview with Dr. Nana Bernasko, who is an IBD nurse practitioner. My name is Sahasra, and I am the founder and president of Code for Crohn's, which is an organization dedicated to using computer science and technology to help serve the Crohn's community globally. Our organization will be hosting webinars, workshops, coding competitions, running an ambassador program, virtual support groups, and running a blog to spread awareness about Crohn's disease through the usage of coding and tech. Follow us for more updates and visit our website, www.codeforcrohns.org, to learn more about opportunities for you to volunteer and support us. Thank you so much for joining us today, Dr. Nana Bernasko.
You're very welcome. It's my pleasure to be here.
So before we begin, could you please introduce yourself to our viewers by mentioning your experience as an IBD warrior to our viewers, including your education, background, your current career, and some facts about you?
Absolutely, love to do that. So again, my name is Dr. Nana Bernasko. I'm a nurse practitioner. I'm currently employed at Penn State Hershey Medical Center in their IBD program. I've been there for almost 5 years, and prior to that, I was at Yale's IBD program in New Haven. I also got my doctorate in nursing practice at Yale University. Right now, I work primarily in IBD, and my patients span from 18 years old until they die. I also have a subspecialty in IBD and pregnancy, and so I work with women who desire pregnancy in IBD and take them through the preconception counseling, and then I monitor them throughout pregnancy and also postpartum. How did I get into IBD? It's a long story, but I started off doing women's health and landed up in IBD, and now I'm able to combine my two loves, which is IBD and pregnancy.
That's wonderful. Thank you so much. So my first question for you, Dr. Bernasko, is what caused you or motivated you to become an IBD nurse practitioner? What was your inspiration?
So funny enough, I think this was just fate, because I did not, wake up one morning and say I wanted to go into IBD. I just ended up with that position when I finished college, my master's, and I couldn't get a job in women's health. I found this position available, and they were willing to train me. And I fell immediately in love with it. And what I noticed was that I was making a huge impact in people's lives. Just the way I connected with people, and I was really willing to fight for people to get them in remission. And so thus the IBD warrior. Fast forward almost 10 years later, I'm still loving every moment of it.
That's wonderful. So what does a daily workday look like for you as a nurse practitioner? What are some of the activities you do?
Wonderful. I'm a bit of a different breed in the sense that I have my own clinic. So I work independently without the physicians, but they are there for me if I do run into any problems. And so I have clinic every day. I see patients in clinic, and then I also have telemedicine appointments that I do mix in with my clinic. So basically, the patient comes in either through a referral. Most of my patients I see through referrals, so they cannot see me unless they have a diagnosis of IBD, right? And so I talk to them about, management, treatment goals, their goals for remission, and then I work them through the process of getting them better. I help them with medication education, also just the psyche of having this disease and having to work through it, and even their day-to-day management of living with IBD. It's pretty comprehensive. And that my full day is literally just taking care of patients, and then, reviewing their labs, ordering colonoscopies, reviewing results, phone calls, updating them on their treatment plans. It's pretty intense.
So how do you connect with patients and support them through their journey with IBD?
So I think the one thing that I have going for me is my personality. I'm just blessed in that sense that I connect with people on all sorts of different levels. And so I find a way to connect my patients, whether it's through, interests that we have together, or just even just talking to them. So that's the first part. I connect with my patients. And then I also give them a platform or a safe space to talk to me. I think that sometimes when we, as patients, even go to see our providers, we get a little bit intimidated. And talking about IBD is not the most fun thing to talk about. I mean, seriously. So I create a very fun, open, very down-to-earth sort of environment. I create that safe space with my patients. And then with that, I gain their trust. And we, have a sort of what I would say more of a mutual agreement of what our goals are. I always tell my patients, I'm never going to force you to do something that you don't want to do, but let's meet in the middle. Let's talk about what we would like to achieve, and let's meet in the middle and decide which way we want to go that works best for you. So I think just one, in connecting with the patients, I'm able to just build this comprehensive sort of relationship with them and then guide them through their processes.
So what is your advice for newly diagnosed patients who might be struggling? What are some resources available for them so they can use that to support their journey to remission?
Absolutely. Very good question. So I work with the Crohn's and Colitis Foundation. They have a ton of great resources on their website. Also, as an IBD patient, I want to encourage you to continue to learn about your disease, know why you're taking your medications, ask questions if you don't understand what's being said to you, and then also find a support system for you, whether it's other people with Crohn's disease or IBD in general, or your family or friends who understand. It is something that is a life-altering disease, and you cannot do it by yourself. So find a group of people who are your champions, who are going to continue to support you in every way to get you to where you need to be in this journey.
That's great advice. So what are some ways people can support the IBD community? Why is IBD awareness important in your opinion? How can people, including patients, get involved in advocating for IBD?
Absolutely. So IBD is not a disease that's visible to the naked eye, okay? People walk around with IBD and you probably would not understand that they have IBD or even know that they have IBD. So first of all, as the outsider, when somebody tells you they have IBD, I think that it's important to learn more about it. Like, what does this entail? What does this mean for the person who is dealing with the disease? That's first and foremost, understand what the issue is, right? And then for people who need to be more aware of this, ask questions, go on websites. Again, the Crohn's and Colitis Foundation has amazing resources for people who are willing to learn, people who want to do more. And then also, how do other people support us? Understand, have an open mind, and make sure that you're listening to people when they're telling you they have issues. Understanding, listening, and being supportive is really one of the best ways to do this. And again, there are other organizations out there that you can support, whether it's doing walks or fundraising, whatever it is. There's so many opportunities. Even volunteering your time with these organizations is something that you could, do as first steps.
So could you describe your thoughts on the significance of mental health and self-care for the IBD community along with gut health? What are some tips or strategies you suggest IBD patients use to improve their overall emotional well-being through the recovery journey?
Very good question. So as I say to my patients, what affects up here in your head tends to affect your guts as well. Sometimes people with IBD get anxious because they're afraid that they may have a flare up in places that they're not comfortable with. Maybe even traveling becomes an issue for them because they need to know where their nearest bathroom is, or, day-to-day living with IBD can be a very stressful situation for the patient. So I tell them again, who are your champions? Who are your forces behind you? How do you calm down and find that place of Zen? I always tell my patients, make time for yourself, even if it's 20 minutes a day. What gives you joy? Is it watching a movie, reading a book, going for a walk if you can, or even sitting by a body of water? For me, that's my place of Zen. Any body of water, which could be a lake, a pool, running river, whatever it is. That's for me, my way of coming back to earth and getting in touch with myself. And again, things that I can't stress this enough, things that happen in your head, meaning your mental stress, can definitely throw your guts off. And so it's so important to have both of those things in balance.
So what are some ways you're connecting and caring for IBD patients outside of the workplace? Could you tell your viewers more about your work with the Crohn's and Colitis Foundation and other outside activities such as advisory boards related to IBD awareness that you were a part of?
Yes, I actually I'm on the board of a whole lot of different organizations. My two biggest ones that I sit on are the American Gastroenterological Association. I was on the Education and Training Committee, and this was more to help other providers in gastroenterology to be able to help patients with IBD. We also developed some of the educational content on that association's websites and things like that. On the other side of the Crohn's and Colitis Foundation, I'm actually the chair of the National Scientific and Advisory Committee for the Crohn's and Colitis Foundation for the nurses and the advanced practice providers who take care of IBD patients. Again, we're the ones who can develop the educational content for patients and also for other providers who treat IBD patients. And so we give tips in, how do you prepare your college student for going back to school? What are the things that you need to teach them or look out for? Simple things as healthcare maintenance, which include getting your vaccines up to date. Things like that, just basic tools to support the provider to be able to help the IBD patient. IBD is very complicated, and it's something that takes time to develop and how to treat patients with IBD. So these are resources that we have out there to help patients. I also sit and on a bunch of advisory committees for different companies, and they work with me from a provider perspective and how to reach providers and teach other providers in terms of new medications or resources that are out there. And so I do that as well. And then of course, fundraising. I do a lot of fundraising for the Crohn's and Colitis Foundation as well. And again, this goes to finding a cure for IBD.
So what are your suggestions for IBD patients when working with their providers, such as with communication and openness? What should newly diagnosed IBD patients be looking for when finding a healthcare professional suited for them? Can you describe the support system healthcare professionals can be to patients as they navigate IBD struggles?
So IBD, like I said, is very complicated, even for the provider and even so much more for the patient who's living with this. I think that as a new patient, first of all, it's so important to learn about your disease. You can't go into something not knowing about it. So once you are diagnosed and you figure out, you've been told you have either Crohn's disease or ulcerative colitis, research, do as much reading as you can, get yourself involved, plugged in, talk to other people. What I do want to stress is that everybody's IBD or how people present may be different from one person to another. So definitely what somebody's feeling may not be necessarily how you're feeling, but at least you can talk on the same platform and understand that what each of you is going through. So that's one. Two, when you start working with a provider, find somebody you connect with. You don't want to be with somebody that you're afraid to talk to. You cannot express yourself to somebody if they're not willing to listen to you or take your feelings into consideration. And so I think that it's so important that you have that respectful, mutual relationship with your provider, somebody you definitely can connect with. And then before you go into your appointments, track the number of bowel movements you're having, track your symptoms, write those down. And then also, if you think of any questions before your appointment, write those down so that in that time period, you make sure that your concerns that you came with are answered during that office visit. And so it's so important that you are open. And if your provider is like asking you questions, don't lie. Tell them the truth. Don't sugarcoat it or don't minimize how you're feeling. If you're having pain, it's okay to say you're having pain. If you're struggling with anxiety, it's okay to say that. I think that's the most important thing, to be very open in communicating with your provider. And on the flip side, as a provider, you have to be able to connect with your patients on some level. Although yes, I've got 4 degrees of education, but I can still talk to anybody. And I think that's what makes it important, what makes me more attached to my patients and my patients more attached to me, because we connect on so many different levels. And I think that is so important when you are, newly diagnosed and you are looking for a provider. And also from the provider's perspective, it's so important to listen to your patient when they are talking to you. And it breaks my heart when I get patients and they tell me, "You're the first person who's ever listened to me and heard my feelings." And I feel like if we are, as providers, are giving back, we're here to help people. Why do we not take the time to just listen to what the issues are? Because if we don't listen, then we're not solving problems. We're solving what we think is the problem. but not really what the patient needs. So
what do you hope to see in the world of IBD in the next couple of years?
oh my God. I hope that at some point we'll get a cure. I mean, that would be foremost. That would be amazing. Even since I started working in IBD, the last decade, we've had a couple of new medications, but there have not been that many. As you're aware, we only have a few medications out for IBD. So I would love some more robust medications out there, especially for Crohn's disease. That would be wonderful. I mean, there's so many people living in the United States now with IBD. It's becoming more, prominent, and it would be great if the community understood. It's one of those things, like I said, it's not written on your face. It's something that's internal that people suffer with. So if we have that basic understanding of what these people go through, then we'll be a little bit more sympathetic and actually be able to join forces in helping to get to our goal.
So finally, what is your message to all IBD patients watching right now?
Do not lose hope. Every win, whether it's this small, is still a win. With IBD, as you're probably aware, you're going to have good days and bad days. But I hope that you can focus more on the good days and work diligently to get more of those days. Mind stress level, I can't stress that enough, that if you need help, you need mental health resources, those are available to you. Again, go to the Crohn's and Colitis Foundation. They have a ton of resources of this, but it's so important to realize that, being at Zen, being at peace with the disease, owning your disease, acknowledge that you have something and work towards getting better at it. As an IBD warrior, I always tell my patients, I'm going to fight for you as much as you fight for yourself. So don't stop fighting. There is remission possible, and just keep fighting.
That's great advice. So thank you so much, Dr. Nana Bernasko, for your time speaking with me today through a Code for Crohn's webinar. Please like and share today's webinar, everyone watching, and subscribe to the Code for Crohn's YouTube channel to help expand our impact on the community. Thanks for watching. Thank you.
Thank you.